dive into the critical world of shock management in the ICU, a must-know for every medical student. This video aims to demystify the management of shock, a condition characterized by the failure of the circulatory system to maintain adequate blood flow to vital organs. It's crucial for those entering the medical field to grasp the severity and necessary interventions associated with shock. Understanding these concepts can dramatically influence patient outcomes in critical care settings. Let's unveil the complexities of shock, starting with its types. Shock manifests in various forms, each with unique challenges. Let's delve into the four main types: hypovolemic, cardiogenic, distributive, and obstructive. Hypovolemic shock is primarily due to fluid loss. In contrast, cardiogenic shock results from the heart's inability to pump effectively. Distributive shock, often seen in severe infections, involves widespread blood vessel dilation. Lastly, obstructive shock occurs when a physical blockage impedes blood flow. Understanding these types sets the foundation for grasping the underlying pathophysiology. At its core, shock is about inadequate tissue perfusion. This phenomenon occurs when the body fails to supply enough oxygen and nutrients to the tissues, a vital requirement for cellular function. Without this, cells begin to malfunction, leading to systemic organ failure. The cascade starts subtly but can rapidly escalate, compromising the heart, lungs, kidneys, and brain. It's this process that underlies the critical nature of timely and effective intervention in shock scenarios. With the pathophysiology clear, let's explore how to diagnose shock effectively. Accurate diagnosis is pivotal in the effective management of shock. In the chaos of critical care, clinicians rely heavily on clinical assessments. Observing signs such as hypotension, tachycardia, and altered mental status can be telling. Beyond visual assessment, laboratory tests provide crucial data on organ function and electrolyte balance. Imaging and hemodynamic monitoring further delineate the situation, offering insights into cardiac function and fluid status. Once diagnosed, monitoring and management strategies become the lifeline. Monitoring is not just watching, it's about making informed decisions. Hemodynamic monitoring, a cornerstone of managing shock, employs both invasive and non-invasive techniques. These include central venous pressure measurement, arterial lines, and echocardiography, each providing crucial data on the patient's cardiovascular status. Initial management often begins with fluid resuscitation, where choices between crystalloids, colloids, and blood products are made based on the individual's specific needs and the type of shock they are experiencing. Effective monitoring guides the crucial next steps of intervention. When the basics aren't enough, advanced interventions step in. In managing shock, fluids are the first line of defense. Crystalloids and colloids replenish lost volume, while blood products are reserved for more severe cases. If fluid therapy fails to stabilize the patient, vasopressors like norepinephrine or dopamine and inotropes such as dobutamine are employed. These medications help maintain blood pressure and improve heart function, crucial in critical conditions. Each shock type demands a unique approach tailored to its specific needs. Customized treatment plans are key in shock management. For instance, managing hypovolemic shock primarily involves fluid resuscitation to replace lost volume. In contrast, cardiogenic shock may require advanced interventions like mechanical support or medications that enhance heart function. Septic shock, a type of distributive shock, necessitates not only aggressive fluid therapy but also antibiotics and rapid source control of the infection. Addressing these specific underlying causes effectively tailors the treatment to the patient's needs. Let's recap the key points to ensure you carry forward the essential knowledge. As we wrap up, remember, managing shock is about swift, informed action. We've traversed the landscape of shock, from its types, hypovolemic, cardiogenic, distributive, to obstructive, to the underlying pathophysiology that drives it. We've examined diagnostic techniques, hemodynamic monitoring, and the pivotal role of fluid resuscitation and pharmacological support. Each type of shock demands a nuanced approach tailored to its specific needs. Dive deeper, ask questions, and expand your understanding. Thank you for joining this exploration into shock management. Stay curious and keep learning.